We're joined now by Dr. Mark Rosenberg, President of the American Society of Nephrology. Thanks for being with us today.
My pleasure.
Can we start out with what an overview is that you have for this year's Kidney Week?
So this year's Kidney Week has the theme of bringing discovery to people with kidney disease, which really fits nicely with the whole past year, where it's been a year where the government has signed an executive order to advance kidney health, and there's been a lot of innovations in the kidney area, as well as accelerators of that innovation. So the theme fits perfectly with what's been going on in the kidney world. It's also interesting that the meeting this year is in Washington, something that was planned many years ago, but it now coincides with all of these exciting policy developments that are going on. So Kidney Week will have that theme. It is structured similar to previous years with 2 days of early programs, some new ones. There's an Advances in Research conference on machine learning, which is proving to be very popular. And other ones that are new, including diabetic kidney disease and onconephrology. In addition, we're doing something a little bit different with the plenary sessions. That on the Saturday of Kidney Week is one which will be 3 TED-style talks. We're talking about innovation and discovery and transformation of clinical care, which will be something unique that we haven't done before. The President's Medal this year will be given to Secretary Azar and many of his staff at Health and Human Services. We'll have late-breaking clinical trials. We'll have over 3,500 posters that will be part of it. There's a special session for educators on the Wednesday of Kidney Week to try and advance their teaching skills. There'll be a session on the executive order. So a lot of very exciting things happening at Kidney Week 2019.
You referenced the kidney world. Why is ASN's Kidney Week so important to the global kidney community?
I think more and more, even though we're the American Society of Nephrology, Kidney Week has probably about 45% from attendees from outside of North America. So it really is a global approach to kidney disease that we take. It's gotten the reputation as being a premier scientific meeting. And as we think about kidney disease, it really doesn't cross geographic barriers in any way. So the way we deliver clinical care, the way we do research, whether basic science or clinical, is really global these days. And I think Kidney Week is a perfect example of how nephrology has become much more of a global entity.
How does ASN's Kidney Week help either shape or affect the way nephrologists care for their patients?
So nephrologists, what they'll learn at Kidney Week, will do a number of things. They'll hear about new discoveries and they'll hear about new ways of treating disease, but in many times they'll often be reaffirmed in what they're already doing. By sitting and listening to experts discuss the approach to different diseases, they'll be able to compare what they do to what is state of the art. And it's really this bringing together of researchers and scientists with clinicians, with other health professions, and with patients that really makes it a unique event.
We've got 13,000 attendees here this week. If there's one thing that you want each of them to take home or take away from ASN's Kidney Week, what would it be?
So the most important thing is a sense of optimism for where nephrology is, where kidney disease is, and that this is really a unique time for both policy making in kidney disease, for scientific discovery, for the ability to translate that discovery into clinical care of patients. I think there's never been a time in the history of nephrology where there's been this much momentum and everything is as aligned as it can be, and there's really a will on the part of many people to make kidney disease more treatable and for the lives of kidney patients to be much better.
You are going to be wrapping up your year as the American Society of Nephrology President. What's one thing that you will be taking with you?
So to me, the highlight of the year was really all these policy developments, which started in many, many years ago, but for reasons that are explainable, it all came to a peak during this summer season in Washington. So having an executive order that's focused on kidney disease is huge for the specialty. It not only shines a spotlight on kidney disease, but it also sets the stage and signals to the broader community, including inventors and investors, that this is a space that it's okay to come into, which can only mean good things for our patients. During this time, I had a chance to have a one-on-one session with Secretary Azar, who's head of the Department of Health and Human Services, which was very fun and exciting for me, as well as to be at the White House listening to and participating in an information session about kidney disease, and then to be in the audience to see the president sign this executive order on advancing American kidney health. So I think that will be my overall highlight.
Dr. Mark Rosenberg, President of the American Society of Nephrology, thank you so much for your time today.